Welcome to the module Vaccines and Vaccination and Overview, a Frontline Forces training presented by Superior Health Quality Alliance, or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It may also be helpful for a family member who cares for a loved one in the home. This course will provide a review of vaccines and vaccination and will build on your current knowledge. Direct caregivers play a critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and understand the needs of these individuals. The purpose of this course is to further your knowledge about vaccines and vaccination and how to use this information. What you know and do can greatly improve the quality and safety of the individuals you care for. This learning module, Vaccines and Vaccination and Overview, is part of a series of modules exploring different types of vaccines that are helpful in keeping both caregivers and their patients safe and healthy. You are reviewing the first module of the series, which provides a general overview about vaccines and vaccination. It is not necessary to complete the entire series in one setting. You can leave and return to any of the modules in the series at any time. Once you have completed this learning module, you may test your knowledge and understanding of the course material by completing the quiz. The objectives for this module include review key terms and ideas related to vaccines and vaccination, describe what a vaccine is, discuss vaccine safety, and explain the value of vaccination for caregivers and patients. What is a vaccine? A vaccine contains biological substances that work together with a person's immune system to provide protection against a disease or illness. Biological refers to a living organism, which can include plants, animals, bacteria, viruses, and many other living things. The immune system is made up of a network of cells, tissues, and organs in our body that work together to protect it against harmful disease or illness caused by bacteria and viruses. When the body recognizes one of these harmful diseases, the cells, tissues, and organs of the immune system all communicate with each other and begin to destroy the virus or the bacteria. Secondly, a vaccine helps to speed up the production of certain antibodies or proteins in the body that protect us from further disease or illness. Think of antibodies as being part of your body's defense or immune system. They help counteract the effects of a germ or disease that infects a person's body. What is a vaccine? Continued. Next, a vaccine is usually given by an injection or shot. Vaccines can also be given by mouth or breathed in through the nose. This helps make vaccines very accessible for everyone. And last but not least, a vaccine provides protection in the future if a person does come into contact with a disease or illness that they were vaccinated against. What ingredients are in a vaccine? Vaccines contain several safe components or ingredients. Many of these can be found in the body, the environment, and even in the food we eat. Vaccines also contain antigens that a person's body does not recognize as natural. We might think of those as being a foreign substance. Antigens can be a bacteria or a virus, and they stimulate or signal our immune response to produce the antibodies or proteins that we described earlier that help provide us with a good defense system. What ingredients are in a vaccine continued? We'll continue our discussion of what ingredients are in a vaccine with a few more points. Vaccines contain preservatives or additives that ensure that the vaccine remains very stable and safe. Preservatives may help prevent a vaccine from being damaged, making it less helpful in the prevention of disease or illness. And finally, a vaccine contains other additional substances that help make sure it remains stable during storage and transportation to hospital, clinics, and other healthcare settings. Vaccine safety. Vaccines undergo very thorough testing and monitoring before they are approved by the United States Food and Drug Administration, or FDA. The FDA has a vaccine advisory committee made up of individuals who have many years of experience and expertise regarding the safety and usefulness of vaccines. The committee helps to make recommendations that pertain to all vaccines in the United States. Vaccine safety continued. The Food and Drug Administration may also on occasion approve a vaccine for emergency use during a very serious public health threat that affects thousands of people. In order for a vaccine to be used during an emergency, the vaccine must go through a very strict assessment process using a scientific approach. As it applies to vaccines and vaccination, one of the key principles included in a scientific approach is to have a very clear understanding of what a vaccine will do, including its safety and how helpful it will be. All vaccines may cause minor side effects after they are given. Examples of minor side effects that could occur after a person gets a vaccine include soreness, redness, or a bit of swelling at the site where the vaccine was given, slight fever, and general symptoms such as headache, feeling achy, or being a little more tired than usual. Side effects usually last 1 to 2 days. The side effects occur because the person's immune system is creating antibodies as a defense against further disease or illness. Once in a while, a person may have a more serious side effect that occurs in response to a vaccine. However, that is very unlikely to occur as it does not happen often. Benefits of vaccination. There are many benefits to getting vaccinated, regardless of the type of vaccination. Vaccination protects caregivers from serious disease and possible long-term side effects that may occur due to the illness or disease. This can result in lost days of work and a loss of income. Vaccination also protects the patients that we care for from serious disease, possible long-term side effects, and complications. Vaccination also reduces the seriousness or severity of a disease or illness if a person does become infected. That's because the person's immune system can build antibodies more quickly and protect the person from getting as sick as they might be if they had not gotten the vaccine. Benefits of vaccination continued. Getting a vaccination means a person is less likely to be hospitalized. Many of the persons that we care for are not only elderly, but many also have chronic conditions that make their ability to fight an infection or disease much more difficult. Young children may also find it more difficult to fight off a disease or illness. This makes both of these two groups more likely to be hospitalized due to very serious side effects caused by the disease or illness, and hospitalizations are very costly. We have already discussed some of this, but vaccination keeps you, our children, our families and loved ones, individuals with chronic conditions, many of whom we care for and who depend upon us, and our entire community safer and healthier. Finally, and contrary to public belief, vaccines do not cause the disease or illness they were created to protect against. Congratulations and thank you for watching. You have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Vaccines and Vaccination and Overview quiz on the Frontline Forces webpage or in the YouTube description below. When you have completed the quiz, you may want to let your supervisor know. This material was prepared by the Superior Health Quality Alliance under contract with the Centers for Medicare and Medicaid Services, or CMS, an agency of the United States Department of Health and Human Services.